Pandemic is such a weird time.
It was a very strange time.
Yeah.
Yes.
But I reflect on this, and I always am curious because we've had a ton of clinicians, obviously, that come on the show that they are in private practice and they were during this time, or just working as a therapist. Being a provider for mental health during that pandemic, did that influence any of the work that you do with anxiety because of how much we saw it during those times? Or because I know you were mentioning you do a lot of work with anxiety and have found, some stuff that you're good at that you work with. um, we saw a ton of that during the
Right.
pandemic. Was that an influence, or were those things you were already interested in?
Yeah, I would say I was already interested, but I did have some clients that it did become, even later on into the pandemic, almost to a phobia level,
Yeah.
really, where it was controlling
Yeah.
their lives and causing tremendous distress.
Mm.
So that was useful, thankfully, kind of working, just like with any sort of exposure practice, right?
Right.
That there were legitimate risks, but okay,
Mm-hmm.
how can you live your life, right, and
Mm-hmm.
do the things you still need and want to do and still practice where it's going to be in a safe enough way for you. So that was really tricky
Yeah.
because it's, then you have to address your, if you had any of your own anxiety around it,
Yeah.
oh, I don't want to go do that, but
Yeah.
either, so yeah, it's interesting.
Yeah. I mean, I imagine you did too, but like with colleagues, it's like we're just as scared as anybody else, especially those first couple months where it was like,
Mm-hmm.
what is happening, right? Or like as it started to hit, where it's like, wait, what? This
Yeah.
no, what? And you mentioned a really important word there, and exposure is like I've often reflected it like it's kind of like that 2.5 year period right when it hit to like until it kind of started to settle down. It's like clinicians, therapists, mental health professionals, it's like we were thrusted into now all of a sudden every treatment center and every practice is an exposure practice
Yeah.
because we're going to have to get back out into the world. And we know that there's going to be a lot of people out there who aren't going to quite want to do that. And I think we work with the direct population where that's going to be the case. Individuals seeking therapy, which really kind of just highlights it